Hello, welcome back to my channel Med Connection. My name is Sugandha Raghuvanshi and I work as a doctor here in New Delhi. I have been doing a series on dengue fever, and in my last video I spoke to you about what is dengue fever. In today's video, I'll be talking about the signs, various signs and symptoms to identify dengue fever. So let's begin. The presentation of dengue fever can be variable. The patients that usually come to us either have asymptomatic or life-threatening symptoms of dengue. Well, there are particularly three phases of dengue infection. The first is the phase where symptoms start and suddenly there is high-grade fever which may develop. Headache and eye pain is very common during this stage, and the patient can also develop body pains and bone pains during this particular stage. Symptoms like vomiting, nausea, loose stools or diarrhea, um, abdominal or tummy pain, hepatomegaly, or the we call it enlargement of the liver can also occur during this stage, but it's not necessary that it can happen. Some people also develop rashes on the body, which is more common in the first. The second phase is the critical phase. This usually occurs in a limited number of patients. The reason being majority of the patient they recover in the febrile phase or the initial phase only. Some patients with severe presentation can actually land into this second phase or the critical phase. This usually occurs when a patient develops secondary infections. This means that the patient who had a previous dengue infection and before he recovered well, he got the infection again, which will put him at the risk of entering into the critical phase, which is the second phase. The reinfection can occur with other serotypes of dengue, which I spoke about in my last video. The usual length of this critical phase is about 24 to 48 hours. The patient can get, um, you know, thrombocytopenia or platelet depletion, which can be very, very severe. And because of low platelet count, heavy risk of bleeding can develop, such as blood in the vomit, blood in the stools, bleeding from the nose, bleeding from the gums, and so forth. This can lead to shock and multiple organ failure can occur, which can ultimately result in the demise of the patient. The third phase is the recovery phase where all of the symptoms and signs I talked about get resolved. The patient's vital signs, they get stabilized. Patient may also develop chronic fatigue, which will take another week, 2 months to completely go away. So this was all about today's video. We have discussed the various signs and symptoms of dengue fever. In my next video, I'll talk about the diagnosis of dengue fever. So please stay tuned. Also, please do not forget to like, share, subscribe, and comment on my channel. And let me know if you have any questions. I'll be more than happy to help you. Thank you and have a great day ahead.